Millions of people believe that papillomas come from a virus. But the truth is, the virus has nothing to do with it. The real cause is something completely different, and even most doctors don't realize it. Today, I'll reveal what truly causes skin papillomas and how to get rid of them safely and naturally. Hello, my dear friends. My name is Dr. John Brooks. Today, we're going to talk about something many people worry about: skin papillomas. Where do they come from? Are they dangerous? And how can we get rid of them safely and naturally? Most people believe papillomas are caused by the human papilloma virus. Even some doctors think so. But the truth is a bit different. What papillomas really are, what we usually call papillomas, are in fact soft fibromas, or acrocordons in medical terms. These are small, soft, benign growths that hang on a tiny stalk. They can appear on the neck, eyelids, underarms, chest, back, thighs, anywhere. They're especially common in people who are overweight. For most people, all skin growth look the same. But it's important to know the difference. How to tell them apart from wart. Wart are indeed caused by the human papilloma virus. If they appear in the genital area, they're called genital wart. If they show up on palms or soles, they're just regular wart. They usually have a broad base and a rough surface, like cauliflower. But soft fibromas are smooth, soft, and dangle on a thin stalk. That's the main difference. Why papillomas appear? The exact reason isn't fully known. It's believed they're a natural sign of skin aging. As we get older, our skin loses collagen and elastin, the fibers that keep it firm. Areas that rub often, like the neck or armpits, can form tiny folds that gradually turn into papillomas. Nearly half of all people on Earth have at least one papilloma. By the age of 70, almost 60% do. It affects both men and women equally. Who is more prone? Certain factors increase the risk: hormonal changes, pregnancy, obesity, type 2 diabetes, insulin resistance, and high blood pressure. All of this is part of what doctors call metabolic syndrome. What about the virus? Research has shown mixed results. Some papillomas contain traces of the virus, others don't. So the virus is not the cause, it's more like a guest that moves in later if the skin gets injured. So remember, papillomas are not contagious. Do they need treatment? The good news is, papillomas are harmless. They never turn into cancer and don't cause health problems. But they can be removed for cosmetic reasons or if they get irritated. Treatment options. Start with lifestyle changes. Improve your diet, move more, lose excess weight. Sometimes that's enough for the skin to heal on its own. If not, there are medical treatments. Over-the-counter creams with salicylic acid can help dissolve small papillomas. But never use them near the eyes. Only an ophthalmologist should handle that. A doctor can also use trichloroacetic or nitric acid, laser removal, cryotherapy, radio wave treatment, or a simple surgical excision. All procedures are quick, done under local anesthesia, and almost painless. Will they come back? Usually not. If you address the underlying causes, such as hormones or weight, new papillomas are unlikely to appear. A few words about warts. Now, about real viral warts and genital warts, they are treated differently. Doctors may use immune-modulating creams like imiquimod or topical chemotherapy agents like fluorouracil. In some cases, interferon or retinoid therapy is used to boost the immune system. Home remedies. There are also folk methods: garlic, celandine juice, propolis. Sometimes they really help, especially for small wart. But always talk to your doctor first. Final thoughts. In most cases, what we call papillomas are just harmless soft fibromas. You can't get infected, and they don't harm your health. They're only a cosmetic issue. Take care of your skin, stay healthy, and don't worry too much about small things. I'm Dr. John Brooks. Subscribe to my channel for more simple, science-based health advice. Take care, and be well.